Up to 55 people are being tested for blood-borne viruses, including hepatitis B, C and HIV, after they were potentially exposed to inadequately cleaned surgical instruments. The tools were used on patients at Hawke's Bay Hospital in Hastings, along with other clinics across the district. 3 children under the age of 16 and 4 people over 70 are among those at risk. Anusha Bradley reports.
On Monday, a theatre nurse discovered a pack of surgical tools that hadn't been properly sterilised. The instruments belonged to a batch containing 91 pieces, which had failed to go through the final step of sterilisation on the night of February 1st and 2nd. Up to 55 people may have been affected by the mistake, including 18 who were operated on at Hawke's Bay Hospital in Hastings. The rest of the equipment was sent out to clinics across the district for dental and gynaecological purposes. Chief Executive of Hawke's Bay DHB, Kevin Snee, says the risk posed to patients is very low.
While this batch of equipment was properly cleaned, heated to a very high temperature and dried, the final sterilisation process was not completed as it should have been. This means there is a very remote chance those patients may have been exposed to an infection. We're reassured from the advice that we have received from clinical experts, both locally and nationally, that any risk of infection is extremely remote.
Surgical tools used in the main hospital can be tracked back to individual patients, but the DHB says this isn't done in outpatient clinics. Patients potentially exposed to infection are being tested for blood-borne viruses, including HIV, hepatitis B and hepatitis C. The DHB's Executive Director of Provider Services, Dr Colin Hutchinson, says patients will have to wait for 24 weeks to be given the all-clear.
The community of patients that we're reaching out to are very understanding and they're very grateful for us reaching out to them in an open and transparent way. And the event review will help us understand why this has occurred. In the meantime, we are managing the patients and our staff to ensure that the patients understand what's occurred and what the care plan is for them. And we're also walking through with our staff, not only to help them cope with the situation, but to ensure immediately that this can't happen again.
The DHB is currently advertising for a part-time sterile services assistant, but Dr Hutchinson says staff shortages are not to blame for this incident.
So we constantly have a number of jobs being advertised, and this wasn't down to a shortage of staff.
Affected patients will be offered a vaccine for hepatitis B, and the DHB says compensation may be considered. Health Minister David Clark admits people may be feeling anxious.
And of course my sympathies are with those people who are facing anxiety and not knowing. It's a small-ish number, but this kind of thing shouldn't happen. But I'm pleased that the DHB itself has taken responsibility for what's happened and are determined to follow up with a proper investigation.
The DHB says that investigation could take a few weeks to complete. In Hastings for Checkpoint, Anusha Bradley.